Hi, welcome to another episode of Cracking Addiction. My name's Philippe Naren and I'm an addiction medicine advanced trainee and GP, and I'm joined as always by Dr. Fergal Armstrong, a GP, addiction medicine and lifestyle medicine specialist. Fergal, good to have you and your expertise on another episode.
Thanks for having me on. Looking forward to the chat.
So in this episode, we're going to be talking about continuation of the previous episodes, and what we're talking about today is Alcoholics Anonymous and smart recovery. We've talked about anti-craving medications and the importance of anti-craving medications. But as we've said in many episodes before this, we're looking for solutions that are not tablet-based for problems that are not tablet-based. And none of the anti-craving medications will work by and of themselves without psychosocial interventions such as behavioural interventions, which is what Alcoholics Anonymous and smart recovery are. So I thought we'd start off with Alcoholics Anonymous. A bit like McDonald's, everyone's heard of it. Not everyone knows how it works or what it does. But Alcoholics Anonymous has been around since 1935. It was founded in America by Bill W. and Dr. Bob, and in the last 86 years has built itself up as one of the preeminent interventions for people struggling with alcohol use disorder. And it's got quite a bit around it, but basically it's founded along the 12 steps and the 12 principles. And the underlying themes are those of spirituality, self-awareness and powerlessness. And it's a peer group-led organisation. It's quite decentralised and has quite a good, robust evidence base. Is that a good summary, Fergal, of Alcoholics Anonymous?
Absolutely. And, everything that you've said is right. There's a couple of things to highlight. The fact that it is decentralized, I think, provides it with this success. Because if it was centralized, it would just end up being, another cult, effectively. Yeah. But because it is decentralized, I think it is able to flourish in multiple different environments and suit the needs of multiple different types of people, while still following and adhering to the 12 steps. So we know that, if you don't like the term Alcoholics Anonymous, you can refer to it as a 12-step program. And we know that there is a significant evidence base for 12-step programs. There was a Cochrane review that demonstrated that adherence to a 12-step program was better than CBT for relapse prevention in the context of alcohol use disorder. But before we launch into the nitty-gritty of what alcohol AA is and what the 12 steps are, I just want to make the point that there are no lone rangers in recovery. You cannot do this on your own. The tablets won't work on their own, and you and the tablets won't work on their own. You need to be part of a peer group or a therapeutic community, because A, it gives you personal accountability to others and helps you maintain your goal, and in this context the goal is abstinence. And B, it allows you it teaches you social networking skills, which then allows you to thrive in life. Because remember, the fundamental point about why we descended into alcohol use disorders, basically we weren't coping with life. So how can you expect to not have an alcohol use disorder without learning the tools to actually cope with life? So, that's how I conceptualize the necessity of skills training, relapse prevention training, peer support in the context of recovery.
That's a great bit of information there, Fergal. And as you mentioned, the peer-led recovery, the peer support, finding a like-minded group of people to assist you on your journey towards abstinence and relapse prevention is vital. And Alcoholics Anonymous also do recommend that at the start their members attend 90 meetings in 90 days, which often means you have to attend a variety of groups because most meetings aren't held on every night of the week in each group.
Yeah.
And that again allows you to expand your social circle, your peer group, and find like-minded individuals whose goal is to assist you. Not to mention the peer mentor program that Alcoholics Anonymous have. So it's very much a new social structure and environment for someone struggling with alcohol use disorder to manage their path towards sobriety.
Yeah, exactly. So, we've all heard the phrase, it takes a village to raise a child, right? It takes a tribe to engage in recovery. So you need to find your tribe. And a common saying that people say when they're involved in Alcoholics Anonymous is that if you attend enough meetings, eventually you will hear what you need to hear, and eventually you will find your tribe. And this speaks actually to the diagnostic criteria of substance use disorder, where a loss of personal relationships is characteristic of alcohol use disorder. And therefore, a regaining or a reestablishment of validating relationships has got to be diagnostic of recovery.
Absolutely. And as we've mentioned with Alcoholics Anonymous, it is a program that's been around for decades. There's been a lot of research on it. As you mentioned, Fergal, there was a recent Cochrane review that showed the efficacy of Alcoholics Anonymous as well as other 12-step programs in their interventions and how successful they've been. But just like any intervention, not every program is for everyone. And sometimes some people chafe at the rigidity of the 12-step framework and the Alcoholics Anonymous program, and they might not really like the spiritual aspect of it. I must hasten to add that Alcoholics Anonymous is not a religious organisation. It's not guided towards one particular religion over another. Alcoholics Anonymous makes reference to a higher power, but that higher power is a generic higher power. And it can be whatever you want, but some people can find the concept of a higher power something like a bridge too far. But we do hasten to add there are other options, and we will be talking about smart recovery. But the purpose of mentioning Alcoholics Anonymous is that it is one of the most research and evidence-based interventions for alcohol abstinence.
Yeah, just on that point about the higher power, I mean, it really just denotes the idea that you are powerlessness in the face of your addiction, and that there is something else in the universe that needs to help you. But I know of a patient who referred to her higher power as a bottle of HP sauce, which is a kind of a condiment that are very, very, very prevalent in the United Kingdom. I'm not sure, do we have HP sauce in Australia?
We do have HP sauce, so I've used it.
Houses of Parliament sauce. There you are. That was somebody's higher power, and that worked for her. And I think if you start enforcing religion into this, then the bubble bursts, and the utility disappears. It becomes a completely different entity.
And we should also mention Alcoholics Anonymous is in pretty much every country in the world, across many geographical areas and across many religious groups. So that just emphasizes the fact that it is not tied down to one denomination. So
we've talked about the themes of what is AA, right? But do you know what the 12 steps are? I mean, can you discuss or tell us what those 12 steps are?
I can tell you the themes related to the 12 steps, which is basically those of powerlessness, self-awareness, and surrendering to the higher power. But off the top of my head, I don't know if I could list each of the 12 steps or the 12 principles down for you.
So if we can go through the 12 steps, step 1 is we admit that we're powerless. Step 2 is that we've come to believe that there is something greater than us. Step 3 is making a decision to turn our will or lives over to God. So that's where we have the spirituality element, but that's basically a surrender. Step 4 is making a search of our moral inventory. Step 5 is admitting to God and to ourselves the exact nature of our wrongs. Step 6 is we are entirely ready to have God remove all of the defects of our character. So again, we're in a reference to the higher power. Step 7, we humbly ask him to remove our shortcomings. Step 8, we make a list of all people we have harmed and all for whom we have become willing to make amends. Step 9 is we make direct amends to such people wherever possible. Step 10 is we continue to make a personal inventory of how we're getting on. Step 11, through prayer and meditation, we improve our conscious contact with God. And step 8, we have a spiritual awakening and we teach others. So there is a lot of God there, but it doesn't. It can be your God, it can be your higher power, but that's where the spirituality element comes through.
Absolutely. And there's also a lot of self-awareness in those steps and reaching into your soul and looking at your behaviors and trying to implement change. So there's a lot of real change behavior in those steps, which is why they're so fundamental to the program and to its success.
Talking to people who have engaged in Alcoholics Anonymous, some of them say to me, well, look, some of the meetings, all they do is talk about how bad people are. You stand up and you say, my name's X, Y, and Z, and I'm an alcoholic, and this is my story and how awful it is. But that's not the only side of Alcoholics Anonymous. There is the recovery side, where there is the sponsorship, whereby you get taken under the wing of someone who's more advanced in the 12 steps than you are, and you can be taught out of those meetings. You can engage in peer support out with those meetings if you want.
Great. Now, moving on to one of the other common programs that we refer our patients to, and that is Smart Recovery. So Smart Recovery is self-management and recovery training. It's a CBT and motivational interview-based program, usually a weekly program of 90 minutes led by a trained peer or AOD clinician. And it focuses, instead of in the past, which some critics of Alcoholics Anonymous say Alcoholics Anonymous is rooted in the past, Smart Recovery is more about the present and the future, and it uses CBT and motivational interviewing techniques to set group members specific tasks and goals going into the forward, usually on certain time frames, and like AA, quite extensively researched and has a very good and robust evidence base. Do you have anything to add there, Fergal, about Smart Recovery?
Yeah, I think that patients should experiment with both types of peer support. And as you say, Smart Recovery has got no focus on spirituality. It's very pragmatic, it's nuts and bolts, and is very much, basically learning the techniques to remain abstinent for the next week. So it's understanding urges, it's understanding self-motivation, problem solving, and it's also about putting balance into your life. These are the principles that Smart Recovery teaches us. And again, there's a very good evidence base for efficacy in that. And overall, both of these programs are very cost effective in terms of the number of people that they help achieve abstinence for.
Absolutely. Now, both of these programs are free for the consumer, so that is excellent. But do you have anything you tell patients with regards to which one they should try, or do you suggest they choose one and then move to another, or is there a particular way you broach this with your patients?
Look, I think because AA is so well known, I always broach the subject of AA, and I think I then gauge the patient's reaction, and I get three kinds of reactions. Reaction number one, I'm a lone ranger, and we'll talk about what that means in a second. Reaction number two, okay. Reaction number three, I'm not a God-fearing person, right? So I'm the Lone Ranger response I get. I sometimes hear people say, look, I don't want to engage with other people. I'm different. I'm special. My suffering is unique. I'm unique. Therefore, no one else can truly understand what I'm going through. Therefore, there's no point in engaging in peer support, and I'm just going to take the pills. Thank you very much, and off I go. That brings its own unique set of problems. The next group of people will say, oh yeah, I'll give it a go, and they always seem to mention the fact that they're aware of it, and they are aware of the spiritual element to it. And they're probably in the contemplative phase. And then there's the third group of people who react by saying, oh no, I can't do God. And that's when I will say, oh well, have you heard of Smart Recovery? And then down the line, when people are engaging in processes, I will say, well, have you heard of Smart Recovery? I will always introduce it as an alternative option. And over time, I actually recommend people do both if they can manage to accommodate the spirituality, the introspection of AA with the motivational interviewing and behavioral techniques of smart recovery.
Excellent. That's very similar to my approach. I usually give my patients a spiel about both of the programs. I've got to admit, most of the patients do tend to go towards AA just because it's so well known, and they often know someone who's been in the program and they have an into a group. But I haven't noticed clinically too much significant difference between the two programs. I think the main thing is commitment to one of the programs and commitment to the paradigms and the teachings and attending group classes and maintaining that peer and social network. And I think that is paramount to the optimizing of a patient's chances for recovery.
I think there's a lot of self-loathing that goes on when you're trying to recover from substances. And, I think that people need to understand that if you fail, if you fall off the wagon, people in AA and people in smart recovery are not going to judge you. Yeah, so there is unconditional affection for all of us, and you're not going to be judged. You will simply be encouraged to dust off the dust off your pants, get back on the horse, and get back into abstinence or sobriety. And failure and relapse is part of the condition of alcohol use disorder, and I think it's important for people to understand that. And it's a really difficult thing to. I struggle sometimes when I'm seeing people and they've had their first detox and you've given them the script for naltrexone or acamprosate or both, and they've attended their first couple of meetings and they're on this high. I'm off it. I've escaped. And at the back of your mind, you're thinking, well, it's early days yet. Let's just see. So how do you deal with that issue? Do you tell them, well, actually, you're going to fail, and when you fail, just don't worry about it because we'll all forgive you? Or do you say, oh, great, this is it. You're never going to fail again? How do you manage that?
I try and be pragmatic about things. If someone's on a high, I don't feel it's my job to bring them down. So I try and encourage people while they're very motivated to try and do as many interventions as they can. But usually prior to any of this, say even prior to withdrawal management or detox, I have a chat to patients about the natural course of alcohol use disorder and what to expect. And the fact basically that I am there for them and the program is there for them and their supports are there for them. You've mentioned stigma and shame and patients feeling really upset when they lapse or relapse and that no one will speak to them again or engage with them, or will they need to find another doctor. I try and make it very clear what the path of alcohol use disorder is. It's a chronic relapsing remitting disease, and as part of any disease process, just because there's one aspect of the disease process that recurs that we're not happy with, it doesn't mean that we give up on the patient or that we stop the treatment at all. So if someone's, to answer your question, I guess I'm trying to say if they're really high after completing withdrawal management and on anti-craving medication, I try and maintain it, but I don't try and bring them down too much.
Okay. And I think, that concept of unconditional affection goes hand in hand with a lack of judgment. We do not judge. I don't judge. I know you don't judge our patients. We don't judge these people. They are weak and they are vulnerable, but so too are we. And there, but for the grace of God, go us all. Go we all. The difference between someone with an alcohol use disorder and someone without is, I think, rooted in resilience, which is rooted in childhood experiences over which we as adults have no control. So I think empathy and a non-judgmental approach is key to all of this, and it pervades the psychosocial interventions that are available to people who are engaging in recovery. Now, I think it's not just about AA and smart recovery. There are other elements to the psychosocial context of recovery, things like AOD counselling and psychology, and especially focused at dealing with the psychiatric or psychological comorbidities. What would you say to that statement, Thalipan?
100% agree with that statement. It's really important that we use multiple approaches to approach a complex problem. it's a bit like diabetes or heart disease or any one of these chronic diseases of great complexity. We don't just try one intervention. A lot of the time we're trying multiple different interventions. And as you mentioned, AA, smart recovery are one part of it, but you do need that team-based approach to assist with the management of alcohol use disorder.
What comorbidities do you see in alcohol use disorder that would merit referral to psychology or psychological input?
The main comorbidity I'd be concerned about is significant depression, anxiety, complex trauma, PTSD, sometimes some of the personality disorders like borderline personality disorder. So things that require probably a step above general practice intervention, and as general practitioners we're well equipped to treat mental health illnesses and disorders. But if I feel this is outside my skill set or window, I have no shame in asking for help or assistance, because at the end of the day, all of us are there for the best service of our patients. Yeah. So again, this highlights the point that recovery from alcohol use disorder isn't an isolated event. There's always a context, and that context usually involves suffering on many levels. And it could be, both physical issues and more likely mental health issues that need addressing. And it's always useful to think of the care of someone in this context as requiring the kind of pyramid of care where family supports the foundation, peer supports the foundation, then you've got the primary care clinicians, and then you've got secondary care. So it's always advisable to have patients linked into some kind of secondary care support. Would you agree, Philippe? Absolutely, Fergal. That comprehensive care is vital for all our patients. And I think on that note, it's a perfect time to wrap up this episode of relapse prevention and the psychosocial interventions that we can use for our patients with alcohol use disorder. Thanks again for your company on Cracking Addiction, and bye for now.